Do it.
There you go. That was a great meeting.
All right, thanks,
Thank
Seth.
you, Seth.
Okay, well, welcome everyone. I'd like to call to order the meeting of the Scituate Board of Health on Monday, September 22nd, 2024. First, I'll make a motion to accept the agenda. John, can I have a second?
You have it.
And I vote yes. And how do you vote?
Yes.
Okay, we have the agenda accepted. So the first thing on the agenda is to discuss the public health nurse update.
So Eileen Scotty is a public health nurse, and I believe she started before the DH was instituted in the American League even, John. So Eileen has been here forever and ever prior to computers. And she retired in 97 and then came back part-time at the 8 hours a week. And that's what she's been doing going forward. And that's what we've been utilizing. And, you know, she retired at the end of the month, at the end of August. She didn't want any big fanfare. I already had that once. I don't. So we took her out to lunch. That's all she wanted. But I did want to recognize her, you know, multitude of years of service to the residents. And she's just a great lady. She's all around town. She's already volunteered to help us with our flu clinics. We do have her position posted. I believe there has been 1 or 2 inquiries. HR is on vacation this week and should be back next week, and we'll have a little bit more of an update. But you know, when I asked Bob over at HR, so we're trying to figure out how long she's been here. And he said, well, when I took the job description out, it was on one of those mimeographed purple paper that you used to get. You remember the stuff you'd get in school and you'd smell it right away? So I just want to thank Eileen for her many, many years of service, and she will be missed. And I'll give a quick update on the flu clinics, since I'll kind of incorporate this into my director's report, since we're talking about the public health nurse. We do have Michaela, who is working with us through the grant. She is coordinating our flu clinics for this year. We are having 2 scheduled so far. We have 1 scheduled for Tuesday, October 22nd from 10 to 2 at the senior center. And people can go online and register for that. And we also have 1 scheduled for Saturday, November 2nd at the community building down on Jericho Drive. And that is also from 10 to 2. And individuals can go online and sign up for those. We will be scheduling, I believe, 1 more. We haven't figured out the date or where yet. So we have our flu vaccine in already. So we're all set to go there. And again, Eileen has already said, oh yeah, I'll be there, don't worry. So between Eileen, Michaela, and the other volunteers that we utilize every year, we should be all set with that. So that is what's going on with the public health nurse update. If anyone has any questions, it is budgeted for 8 hours a year. I mean, 8 hours a week in the budget going through June 30th would be the last day. I'm probably going to be looking to maybe upgrade the number of hours. I'll see what happens with the individual who we do hire, if there's any desire and if we can figure out a need. But that's, I would kind of like to get a little bit more consistency than just 8 hours a week.
Yeah. So I'll just join you in thanking Eileen. That's just, she's made an incredible mark on our town. So it was great. I'm glad you brought that up tonight. Related to the replacement, if you need any help, like I'm happy to meet with candidates if you want me to.
Oh, that would be great.
Yeah, just, you know, nurse to nurse, we can have
Yep, that's fine.
And then my other question that I had was around the flu clinic. Have there been any thought, I think we maybe talked a little about this on another call, about, doing COVID at the same time. Like, I don't know if we have access to
We
COVID.
do not have access to
We
the
don't.
COVID. We have access to COVID test kits, which we have been distributing to the town hall, the senior center, the library, and other areas, like different offices will come in. The harbor master's office will come in and grab some. But we do have the test kits, but we don't have access to the vaccine right now. And
I'm wondering if it's
anybody who
worth, like,
calls us, we give it to,
you give it
you know,
to, yeah.
CVS, yeah.
I'm wondering if it's worth considering it for next year, having a conversation. We'll see how it develops, but I know there is a push to call this like respiratory season and not flu season anymore, and being able to kind of give both vaccines at the same time. So it's like a convenience factor, I think, for
Yep.
those, can't do that. So it might be worthwhile thinking about that for next year if it's possible.
I'm still wondering if they're ever going to come up with a way to incorporate it within
Yeah.
the flu vaccine.
I know.
But-
Maybe, who knows? Maybe next year
I
they
know.
Possibility.
Yep.
Great. Okay.
So with that, I will go to the beach season.
Beach season.
We actually almost had a tremendous season this year. Unfortunately, we did have one beach closure, and it was back in August 21st. It was right after one of the hurricanes had come up. We believe this is just, we'll never be able to prove it, but we did have a high reading at Lighthouse Beach. It was in excess of 1,600. And because it was so high, we actually have to take 5 tests in a row to knock that number out, because that number in there, along with 5 other tests, will bring our geomean up over the threshold of 34. So we did the 5 tests and got it down. But just that week of sampling that we did, all of our beaches were higher than what we usually see when we've been testing all year long. Egypt Beach was 86. Hammerock was 51. Minot was 20. Peggotty was 86, and Sand Hills was 74. And through most of the season, I don't think we had maybe one higher than 20. Everything else was usually less than 10 on all of our testings that we had done this year. So who knows, but we did have a great season. We are all done. All the beach mats have been brought in. All the signs have been brought down. So we are all ready to start next year. We'll put the final statistics on the beach report together, and it'll be incorporated in our annual report. So that is where we are on the beaches. Any questions or concerns or comments?
Nope.
Great job.
And then on the mosquito, we have hot off the press, came in this afternoon at around 3:30, weekly arbovirus surveillance report. So September 10th was the last night of spraying by the trucks for Plymouth County mosquito control. They will only spray now if it's necessary, and the only way it would be necessary if we would find positive mosquitoes of triple E. If we found a mosquito of West Nile, probably not. We've only had one positive West Nile mosquito pool in the town that was reported back in early August, late July. We haven't had any other samples that were positive, but throughout, Massachusetts, we have had 4 identified human cases of triple E, and they were in Middlesex County, Plymouth County, and Worcester County. We had 2 horse triple E cases in Plymouth County, and we also had 95 positive triple E mosquito pools in Barnstable, Bristol, Essex, Middlesex, Norfolk, Plymouth, Worcester. So basically all over the map. So even though we haven't had them here, we're at that time of year now where a lot of travel games for outdoor sports. You're going to different communities. It's out there. So one of the things we want to just make sure we tell people is continue to wear your mosquito repellent with DEET. If you're out at dusk and dawn, long sleeve shirts, long pants. Make sure you protect your home. Screens, make sure they're in good repair. Standing water, make sure you empty standing water. A couple of other numbers that, just so we can throw them out there. The number of mosquito sample pools tested, almost 8,000 mosquito pools were tested. The number of West Nile virus positive samples were 317. Triple E 95 out of it was 7,938 sample pools that they actually tested this year. So again, we have stopped the spraying in Plymouth County as of now, but there's always ways you can still protect yourself. And that is it on the West Nile and Triple E updates and the final for the spraying. We did have, I'm amazed, we get the spray list of all the streets that they spray in town every week. People really respond. They're probably sometimes 20 different streets in the queue that they'll be spraying on that given night. So it's a good thing. People notice it out there. They utilize it. I think the last on September 10th, 6 streets were on there.
Oh, that's great. Great.
So.
Okay, well, thanks for that update on the mosquitoes. And it looks like we have no old business and no new business. Director's report, did you cover it mostly, or do
I basically did. I would just like to say that, we do have 15 sets of plans under review right now. We have 6 waiting engineering review, 3 waiting Concom. We have 12 awaiting as-bills to come in, and we have 19 in failure right now. Also, I went before the board, the select board, to ask for an additional $200,000 for the, what's the program? The sewer betterment program.
Okay.
Because remember how we were running low on funds?
Yep.
So they have to allocate the funds to us, and then the state brings it back to us. So that was approved by the board, and that will go on town meeting come the spring when we vote. So
Great.
that
Great.
should be all good too.
Okay, great. All right,
I
so,
do have a couple of invoices.
okay, good. I was going to invoices next. Go for it.
I have 5 invoices. I have 2 for flu vaccine that we have purchased, one for $13,458 and one for $8,043.96. And I have 3 invoices for perks, all at $280 each.
Okay. So I'll move to approve the invoices. And
I
John,
second
vote
it.
yes. Good. And John, how do you vote?
I vote yes.
Okay. And then I think our last thing to vote on are the minutes from the meeting in July. And I
Yes.
don't have any edits for those meeting minutes. I don't know, John, did you see anything that you needed to have
No,
updated? Okay. I'll make a motion then to approve the minutes, and I'll vote yes. And John?
I vote yes too.
Okay.
All right.
I think
We
that's
are all
we have.
set.
Yep. So I'll make a motion to adjourn the meeting for tonight.
So
John?
moved.
Okay. I think we're set then.
All right.